These days, it seems like every big Silicon Valley name is working diligently to enter some area of healthcare. Amazon recently bought the digital pharmacy PillPack. Apple is working on electronic health records, wearables, and the connected patient. Google is developing algorithms to detect diabetic retinopathy. There's companies like AliveCor that can record your EKG in real time. Out of all this that's going on out there, what do you guys think is the most likely entity to find success? Colin, let's start with you.
So my money is on Amazon for two reasons. One, I think they know more about you as an individual than anybody on the planet. They know your buying habits, they know when you buy stuff, they know where you buy stuff. I think that data will become extremely valuable as we continue to move more into the social determinants of health. We look at the nutrition, we look at all those things. Amazon's got their hands on that information. And now you add in all the medical information that could potentially have from PillPack and some of their other acquisitions. I think they're going to have the most data, which I think is going to make a big difference. And the other thing about Amazon is that they put a huge focus on the customer. And they do everything for the customer in terms of streamlining the purchasing, offering things that you will like, offering things that they understand your needs and your wants. So my money's on Amazon for the reason of they understand us as an individual, and they actually have built an organization that really truly innovates around the individual and make things so easy.
Jane, you're our economist, so
Yes.
tell me what you think about this whole thing
Yes.
with these people moving in.
Well, I'm with you, Colin. I think Amazon will be not just an disruptor, particularly on the data front. Also Whole Foods, obviously, and everybody loves Prime, just-in-time stuff. But I want to talk about a company that doesn't get a lot of play on this issue of technology disruption in health, and it's Walmart. The reason I bring Walmart up as an economist and a health economist is that I want to move the needle on chronic disease. I want to move the needle on overweight and obesity. I want access. Walmart operates in lots of rural areas and is a primary care provider in a lot of rural areas that don't have access to GPs. Walmart is very tech savvy, and in their reorganization now, while they've been very big, of course, in health and beauty, about 30% of their income in front of the pharmacy. Let's not forget they're a huge pharmacy at the back end as well, behind the counter. They have their own kiosks, Higgy style, that are picking up people's blood pressures in the afternoons. They will try to acquire Humana, the insurer. Therefore, we can see this vertical integration between grocer, pharmacy, health insurer. Humana just acquired a palliative care company for end of life. Humana is huge in Medicare Advantage. We start to move the needle on older people. We start to move the needle on the people who have the bulk of the burden of chronic disease, who don't have access to health care at a low cost. That makes my heart sing. So I'm betting on Walmart as one of many of these players that might not get a lot of play.
So John, you work with Google. What do you think Google's role is in this whole space of disruption of healthcare?
I think it's a little bit more complicated. When I got my AliveCor EKG machine that I keep in my wallet, I got it from Amazon. But who was the innovator? Dave Albert, right, was the innovator at AliveCor. So I think about these large consumer groups, and I look at them in the context of innovation. So innovation is a three-legged stool to me. There's the lightning bolt, the cool stuff. There's clinical development, do the trials, see if it works, make it clinically relevant. And thirdly, there's market access. To me, Amazon and potentially Google lives on the market access side, but they don't own innovation. With the exception of analytics, I haven't seen an innovative product come out of Amazon. Have you?
No, they're great marketers. And
so why do we hold them up as the definitive innovation company? And I'm going to go back into pharma. God bless pharma. Pharma isn't dead. Pharma isn't dying.
Did you just say that?
Pharma is coming up with
postcard?
powerful innovations. They are really the bastion of science that are coming up with, academia and science coming up with CRISPR and immuno-oncology and personalized therapy. So I'm not willing to give the farm to Amazon just yet.
I agree with both of you. So, and again, I'm a rheumatologist, so I love old people. And Jane, you're right. It's about chronic diseases. And Amazon's great. I'm a Prime member. But Walmart, That is something, right? Pharma, there's an opportunity. I mean, I really think that, again, it's fundamentally about access because you've got to be where the consumer is. And there's a lot of them on Amazon, so good for Amazon. But what about everybody else? And when we look at economics, there's a whole portion of the country that's actually not on Amazon.
Yeah, and we can't stay in a geek bubble. We have to really think about at the end of everybody in health, and there's so many underserved people. Again, health literacy, we can develop communication, education materials that are perfect for whatever people want. Just let me add just one more building block to Amazon, and it's important. You talked about innovation. Amazon Web Services, their clouds, have a whole lot of data. I almost cursed and used a bad word. A whole lot of data, and banking data, retail data, data from Philips, data from Salesforce. Everybody's working with the Amazon Web Service clouds, so don't count that out for, again, on the analytics side, data is the game. So Amazon's got a lot.
But I think one of the other things that, you're right, maybe Amazon isn't the grand innovator of a lot of things, and certainly they're not going to maybe not do that in the clinical side. But one thing that I'm encouraged by Amazon is that they've democratized pricing in a lot of industries. We know exactly what it's going to cost for this book, and guess what? The book price is the same almost everywhere now. Why? Because it's so easy to find out, and it's flattened it. I'm hoping for that in some of the medical things that they're going to do. They're going to flatten, they may not solve the drug pricing issue, but at least it'll flatten it, where it's like, you know what, it's this price, and we now accept that it's this price.
That's
and it's
right.
transparent.
And even if mom and dad shop at Walmart, the kids that are often taking care of mom and dad are on Amazon.